Yeah, I just shared
Right.
it.
Okay, then. Good afternoon, everybody. Good to see you all again. This is Sandra Cherfilus. I'm the president of the Democratic Women's Club of Greater Broward, and today I have the opportunity of speaking to Sheila Cherfilus McCormick, and she's running for a representative seat, right? United States representative seat. You want to be a part of the House. Be part of this big change that started in 2018. So I'm gonna just give you an opportunity to introduce yourself and, just tell people about you and what call did you hear and why did you answer the call to run for this position, and then we'll talk about some more specific thing as we go along. The only thing I want to remind people is to complete your census, 2020 census.gov, and also to request your mail-in ballot, because this COVID situation is up and down. We don't know what's going to happen. So you can go to browardsoe.org and request your vote by mail ballot. I believe they sent some stuff request out like 2 weeks ago. So if you just fill that out, you can also use it as a way to update your signature. So you can vote by mail just in case it's difficult to go out and vote in the primaries that are coming up August the 18th, 2020. All right, Sheila, I talked a little too much. Go ahead.
Hi, good evening, everyone, and thank you so much, Sandra, for having me this evening. My name is Sheila Cherfilus McCormick, and I'm running for United States House of Representatives District 20, which encompasses Broward County and Palm Beach County. My background, I'm a mom, a wife, a healthcare executive, and a lawyer. For the last 10 years, I've been knocking on the doors of Congress, walking the halls, demanding that healthcare disparities end. I've been in healthcare for approximately 20 years now. So I've seen the ups and downs of healthcare. I've seen the impact of the Affordable Health Care Act, and I've seen the impact in the stripping away of healthcare for our families. But realistically, and more importantly, what I've seen is that certain communities are being more and more disadvantaged. And we're at a place in our country where, healthcare and who lives and dies is really determined by economic standing as well as race. There's been huge disproportionalities when it comes to healthcare, especially in our district. Our district has a wide variety of different backgrounds and cultures, and we see that we happen to be the most devastated. With COVID, COVID just really expanded and put on blast all the inequalities in our system where it comes to economics and healthcare. And we see that we're suffering from a large number, more than other states and other places. But most importantly, we're still not getting the help that we need to cover our healthcare. So how did I get into the race? Well, in 2018, I decided to run. So I was raising a daughter for the last 12 years. I was a single mother for 12 years. And as a single mother for 12 years, I was raising a daughter with a healthcare issue. She has a learning disability. And, me and the teachers, we wrestled trying to find the developmental support that she needed. We worked tirelessly, and I just couldn't really afford everything that she needed. And I started talking to other people, and I started seeing that other people who had money had access to that kind of treatment and help and therapies. And, I sat there for a few years suffering silently, watching her become more and more just low self-esteem because she felt like she couldn't compete. And then one day something just clicked in me, and that just really changed me from a voter to an advocate. And so ever since then, I've been really fighting to make sure that the healthcare discrepancies and disparities come to an end, because, every child is deserving of developmental support, not just children who come from rich families or from certain backgrounds. Every patient who's suffering from different types of cancer deserves to have the right types of treatment, not just one or the cheapest treatment, or they shouldn't have to go into debt trying to find treatment. And so I've been on this path now fighting. COVID has really hit us hard. In our district, we've been a hotspot now 2 times around, right? First time we were a hotspot, now we're here again. And there still has been no national plan. There's been no state plan to make sure that we're even getting any kind of help. And these are the things that make it imperative that this time around that we actually take a stand and start electing new people, because we can't expect, after 27 years of the same representation in Congress, that this time around is going to be different. And so if we really want change, we're going to have to stop recycling the old things and really start supporting new leaders with new ideas and who have the experience to pull us out of this turmoil we're in right now.
All right, so I'm gonna ask a couple of things, okay? So you said you were a lawyer, and then you said you were in healthcare for 20 years. Clear that up for me. Are you practicing law, or you're in the health field? I don't understand. Or you do healthcare law?
So what happened is I went to the I'll bring you back. I went to Howard University for my undergrad. I did my MBA at University of Maryland. I went to St. Thomas Law School. So when I first came out, I got into healthcare regulation. And then after I was doing healthcare regulation, I started moving my way up the ladder. I don't know if you are aware, but at that time with the Affordable Health Care Act, healthcare became very regulation heavy. So, you really did need lawyers in that capacity, understanding the law so they can help get reimbursed. So that kind of gave me an opportunity to start looking at the regulations and how do you get dispersed? And if I put in my request for healthcare or coverage, why am I not being covered? Like that really opened up my eyes to the disparities because I saw a lot of families who were doing everything, a lot of practitioners who were doing everything. And when they submit that bill to Medicaid and Medicare, they weren't getting paid. And so we would literally see kids who were not having insurance, not having coverage, not having the nurses they needed there. And that was devastating. That was very eye-opening. So I continued in healthcare and I'm not practicing. And so now after 20 years later, I'm a healthcare executive.
Okay, then. Okay, so that's what it is. 'Cause I was like, she's a lawyer, and then she said she's been in healthcare. I was trying to understand, but thank you for clearing that up. So, you said a couple things that we're going to talk about. You explained why it is that you want to you want to run, and it seems as though healthcare is your main focus. Are there any other issues that you want to address when if the people send you to DC?
Yes, our other legislative priority is actually economic development. Being in the healthcare executive capacity, we actually have also a vocational school where we teach a lot of trades. And with that outreach and teaching people in the community those skills, we've seen an abundance of job development. We've seen prosperity, especially where we're located. We've actually been in Miramar for over 26 years, and we actually have our office in East Miramar. So we actually trained a lot of the individuals who are living and we've seen them prosper. And so I've seen firsthand and been a part of the experience where we know that once you start teaching more trades, job skills, and even mentorship, it really does give an economic boom, especially right now. Right now, we have a lot of economic issues, especially when it comes to infrastructure or economic opportunities when it comes to infrastructure. Our environment right now is becoming prioritized and becoming a priority for everyone. We see with the recent spill that we had in Fort Lauderdale, the sewage spill, which was the largest that has ever occurred, that we have to do something about our infrastructure right now. But what a lot of people don't know is that Congress is getting ready to pass an infrastructure bill or introduce an infrastructure bill. And in that infrastructure bill, there are a lot of jobs that are tied there. And we have to look at ourselves as a community and ask us, are we ready? If those jobs opened up tomorrow, do we have people in our district who can actually get those jobs? Or are we going to have other people come into our district and do those jobs? And I can tell you right now, we are not ready. We do not have the job training infrastructure in place, so our district can have people who are working, especially in a time right now when we have so many Americans out of work. So we have to attack that quickly to make sure we have job skills training. We also wanted to do another program where we're actually providing grants to people who are 55 and older. So if you're 55 and older and you live in the community in which needs some skills training, and you actually start doing it, we want to give you a grant, because what we're noticing is that we have a large population of 55 and older, especially in our district, who want to work. They want to find another means of being included or reintroduced into the work capacity, but not working the same hours. And they do have a lot of valuable skills where they can start helping and having the skills and the programs that can help the younger generation. So economic development is a very big platform of ours. I think if you had to weigh them both, I think they're both hand in hand, especially right now, being that we're in the middle of COVID.
Okay, why do you think the people aren't ready if these jobs became available today?
Well, they haven't been trained, right? If you look at the infrastructure programs, we just don't have enough people who are trained in trades who can pick up majority of them. We have a project that's further north by, Pahokee and South Bay. They already started some programs there, and they're not having enough people who have the skills to actually come in and take those jobs. So there are other people coming into the state, and we don't want that to happen, especially when we have so many Floridians who are applying for unemployment, still waiting for benefits. Why not train us now? Why not put the money out and start training people while they're home so they can actually take advantage of the infrastructure bill and the job opportunities that are coming from it?
And what's the skill set that those opportunities that are presently available looking for?
Well, they're engineering trades. There's a lot of pipe work that needs to be done. There's a lot of groundwork that needs to be done. So different types of engineering trades that are embedded into infrastructure.
But wouldn't that be like, if you're going to be an engineer, isn't that like a 4-year degree as opposed to a vocational program?
Well, there are different levels of engineering. There are
Okay.
trades that are also referred to as engineers, where
Okay.
are lower level. So a lot of them, when it comes to fixing bridges, when it comes to fixing canals, those are trades. Those aren't the bachelor's level of engineering. You can actually have trades that incorporate you into engineering.
So that's almost like a construction side of it.
It could be a construction site. It's a little bit different because when you're talking about piping and underground work, it's a little different. It's not the traditional construction that you think of.
Okay. All right then. So another thing. So when you the areas that you mentioned, you said like South Bay, Pahokee.
Mhm.
I have some familiarity with that area because I practice immigration law, right?
Mhm.
And there, from what I know of that area, it tends to be a lot of immigrants in that part of the country. So, would you, if and when you become a member of Congress, what type of immigration legislation would you support?
Well, I think we definitely we need to restructure our immigration programs to make sure that we have a path to citizenship for everyone who is in the country. We just can't allow different people to hide in the dark. And when I say different people, different immigrant groups, it seems like with this president, there's always a different community who's on the chopping block, right? There's always someone who's being targeted. And when immigrants who are here feel like they have to hide, then they're being taken advantage of. Even as they're working on different farms and working as migrant workers, because they're in hiding and their employees know that, they take advantage of them and they're getting paid barely anything. And so we have to create a system where they feel comfortable enough to come out and start applying and having that path to citizenship. And that's something that we have to take very seriously, especially in our district, because our district is composed of so many different people and different immigrant groups, that this is something that's very dear to my heart. Also, my parents actually came from Haiti. They came here during Duvalier and they migrated here. So I understand how it is and how hard immigrants works. I'm a first generation American. So that's something that's very close to my heart, to make sure that we do create that pathway and stop the, demonization of what people think about, immigrants.
So would it be something somewhat of an amnesty program, or would it be because we have a couple groups that have like temporary protected status. We have like
Correct.
a bunch of nationalities where some of the people have TPS, right? That's temporary protected status. DACA just got like a big win. Well, I mean, it was a win. I mean, anything is better than nothing, right? So the DACA recipients also got a big win. Are you looking to create a path for citizenship for the TPS holders, DACA holders, or people that are trying to do immigrant? Because that usually you have to have somebody that can file for you in order for you to get an immigration benefit, or you have to maybe qualify for some program. Are you looking at more of like an overall amnesty program that anybody that's in the country out of status as of the day the law passed can apply? Or are you looking more towards the people that that are TPS holders, DACA holders, or persons that have family members that can petition for them to allow them to get status?
Well, we have to actually deal with immigration from a systematic standpoint. And dealing with it from a systematic standpoint, we can't start with a amnesty program for everyone, right? So if we start with the TPS holders and the DACA holders, I think those are the two priorities that we have to start with as far as ensuring that we have that clear path to citizenship. And as we start with them, we can make sure that, because they're already here, they've been here. If anything, they've been paying taxes just like every other American, and not being able to, fully exercise the right to become a citizen after paying, so much in taxes. If you look at the amount, there's millions of dollars that you have TPS holders paying in taxes and working here and actually holding up our system. As I mentioned, I've been in healthcare for over 20 years, and most of our people who are employees, who are working in healthcare, who are working as CNAs, who are working as HHAs, who are really holding up this healthcare system, a lot of them are immigrants, and they started off as TPS holders. So we have to actually look at the benefit and look at what they're contributing and be fair to everyone who contributes to our lifestyle, where we can live comfortably. If COVID has taught us anything, we see the need to make sure that we're protecting our frontline workers. And you better believe immigrants are part of our frontline workers, along with the grocery store people, along with people who are working in healthcare, and not just the doctors and the nurses, but as I mentioned, the home health aides and the certified nurses assistants. So we have to start taking care of everyone who's been taking care of us during COVID. And that really takes us to where we have to look at ourselves as a nation. Are we being fair when it comes to immigration? Are we being fair even when it comes to a living wage? Medicaid right now, Medicare, they're still paying some of their nurses who actually provide care to Medicaid recipients $13 an hour. Some of them are getting paid even less. So if our federal government is not even giving a living wage to the people who are risking their lives every day, who are we as a country? What are we really doing? Are we really protecting and serving and honoring the people who are serving us and helping us bring down the numbers during this pandemic? So what we see is that there's a need for a systematic change with our immigrants, also with our workers, and even with the unemployment that we have going on right now.
Well, in Florida, it's like they're trying to get unemployment. I think some people applied back in March and they're still waiting on a check or something like that. And so that is definitely something that needs to be addressed, okay?
Yeah.
You said something about the CNAs or the nurses making $13 an hour or something to that effect. There's a movement that is slowly going across the country where they want to have a national minimum wage of $15 an hour. Would you support something like that?
Most definitely. I stand very strongly in line with that. And for the reasons that I said, during COVID, some people had the luxury of being home. But what we saw were the people who were serving on the front line, along with the doctors and the nurses, they were getting paid less than $15 an hour. And they were out there. And as they were out there, they would, some of them didn't even have protective gear. They didn't have masks. They didn't have gloves. But they went to work every single day, risking contracting COVID. So I strongly stand with the minimum wage being $15 an hour. There's so many families that don't have childcare. There's so many families that are starting out. Even people who are college educated, who still aren't getting paid $15 an hour, and they're subjected to all the student loan debt. And this is where we go back to the time for a comprehensive reform. Comprehensive reform is what's necessary at this time. And if we can't see it now and actually get up to make sure it happens, then I don't think it'll ever be done. And the people who I feel are more comfortable right now and saying, oh, maybe we should or maybe we should, I believe are people who are ingratiated in the status quo and don't understand how much we are really suffering out here.
Yes, and you said something about student loans. So would you support a loan forgiveness program? I know they have some things that are out there that if you work for an agency, they'll take off like a certain percentage every year or something like that. So loan forgiveness is one big thing, particularly those students that went to those for-profit schools, and some of which have closed. So if you support something to have those students not have to pay that money back. I mean, they're owed to someone, but I mean, they ended up with $40,000, $50,000, $60,000 in loans with no degree and also no credits to transfer, right? Because some of the schools were like that. What would you offer a student in that particular situation, or someone else that have like a ton of debt and they're really not working and making sufficient amount of funds in order for them to pay that loan and maybe, buy a house and have a decent job and move out of their, mom's house or something like that? What would you recommend?
We have to expand our loan forgiveness programs. When we first started off with education and when we first started off with college and the student loan program, colleges back then were not so focused on profits, but somewhere along the lines for the last, I want to say 10 or 15 years, colleges have really changed. We found all these schools popping up who were for profit. All of a sudden they're telling you that their degree is worth $300,000. So they're going to give you this loan of $150,000 and you come out and you're looking at a job that's $20,000 a year. And it wasn't honest. It wasn't honest. It wasn't honest. It's not fair. And we were taken advantage of. And if you look at it, it was kind of the same kind of scam they were doing, right? During the housing crisis, and I think that we have to punish the industries who continuously keep changing the game so they can trick the hardworking Americans, right? Because that's exactly what's behind it, right? It's another trick, right? First, you're buying this home, you're excited, and you're like, I just finished school, I'm excited. I saved all this money, I'm going to buy this house. It's worth $200,000. and then boom, it's worth nothing. And
So
you're
those people that were buying 6 houses because they had no income, no asset verification, and I'm just
yeah,
like, what kind of job you have? Why do you own 6 houses, right?
right. You remember that?
Yes,
And
I
so then,
remember that clearly. I remember
yes,
that people were buying 6, 7 houses, and it's like, but you do what? Like, you the radiology tech at this place. Like, why do you own 6 pieces of property? You know? So
yeah, that's exactly it. And so industries, punishing industries, right? That takes us where we go, right? We have to do that, take it seriously, because there are certain banks, certain lenders, they do this as sport. You know, their sport is to trick the hardworking American person to get you caught up. And those institutions need to be punished. And the same way, if we find that there are some schools who were inflating how much their degrees were, inflating how long they were going to be there, and kind of took the money and ran, we have to forgive that, because it is not fair. We are not making our country better by stifling our young and talented. You know, that is a recipe for disaster. So we have to expand the forgiveness program. We have to punish these lenders, because you know those lenders will close today, open up tomorrow under a different name.
exactly.
You know, and we all know that it's the same lender out
Yes.
there playing the same game in the same hustle, and that has to come to an end. You know, I'm in healthcare, and I say that all the time because, you know, I've seen all of it. And in Florida, I remember probably like maybe 15 years ago, there was a lot of changes, because they said healthcare has a lot of fraud and abuse. You know, fraud and abuse. We need to have these regulations. You know, you're subjected to surveys where it's pretty much they come in and they check you out. Are you guys up to par? There's a reporting line. So there's so many regulations in healthcare, and I've seen it. It's gotten better. You know, now there isn't that much fraud. They're hardworking people. We're here doing what we have to do, and it works. So I feel like if we can do that in healthcare, you know, anybody else who wants to be a public offender, and that's what I call them. When you're scamming American people, when you're coming after us to trick us, hardworking families, you are an offender. I think we should have some regulations on them to make it tough for them to even try to do it again. You know, it has to be something that deters you from targeting people and tricking them.
Okay.
And, you know, we see it also when it comes to payday lenders.
Oh,
you know,
that's where I was gonna go. I was absolutely going there, because there was just a
I'm
story.
with you, girl.
Listen, I'm telling you, we were on the same page. I'm like, what y'all gonna do about those guys? Because there was actually just a story where this guy, he was in a paper probably a couple of weeks ago, where he had borrowed like probably $2,500. So that meant that he went to like maybe 4 or 5 different places, right? By the time he paid those people back, he was out 50 grand. It took him 5 years of like paying, you know, robbing Peter to pay Paul the whole time to pay this money. He was out $50,000 on what originally started off as a $2,500 loan. So what can be done about this? And those payday people have been around for a long time. I knew about them like in the late 90s, and they're still here playing this same game with folks.
Sandra, you about to make me have to turn in my chair.
I have to sit up straight. Let's talk about this. What can we do about them folks?
Let's put a name with a face and just talk real who they are, right? If you look at one of the biggest,
F. Scott, like all them people.
Girl, don't shout them out, right? Okay. So if you even trace back to find out who is the founder of AmScott, who is running AmScott, he had some ethical issues where he can no longer trade and do all. I mean, when you have a history of being unethical, we're going to allow you to now open up this business and loan money to minority areas. And there's a discrepancy where
not only minority, it's low income. It's some poor white people getting played by that too, right? So it's not only people of color, right? I think it's more just a poor people thing.
Right. So they're charging up to 300% in interest in some areas. And the federal government has chose to ignore it. Yeah. And now what you find are states are actually saying, no, if you're going to be in our state, you cannot charge this amount of interest. But what we're noticing is that if you go back and you look and see who they're donating to, you realize that they give a lot of money to people in Congress. And because they're giving a lot of money to people in Congress, that is why Congress has turned a blind eye, even in our district. I mean, every corner I look and I see AmScott. But if you look at it and see, okay, I want you to find out who AmScott is donating to, and you'll find that it's our president incumbent gets a lot of money from AmScott. And that's why the federal government isn't doing anything. But if we're going to be serious about protecting our people, then you can't allow that to happen. Even when it came to the Paycheck Protection Program, you know, there was a letter that was sent to Congress asking for them to include the payday lenders. What? And our congressman signed it. Our congressman signed it. So you mean you feel more tied to including payday lenders before you're including your constituents. And you know how hard it's been for us to even survive as small businesses. I
Yes,
mean,
yes.
let's just be, we got to be honest about it. And that's where I talk to people and I'm like, listen here, after 27 years of the same representation, we must ask ourselves, is this working for us? Is it? You know, because if it was working for us, how are we in a situation where we're being totally destroyed by healthcare inequality? And I can tell you for the last 10 years, I've been talking about healthcare inequality and how our district needs it, and they ignored it. No one wanted to do anything. It's too hard to regulate. How do you do it? It's not hard at all. You know, it really isn't that hard, and we can't do it. So what are we doing? We have 1 in 7 elderly seniors who are living in poverty. 1 in 7. Our district is mostly elders. How are they living in poverty? Then we have our veterans who are still struggling to get benefits. Yesterday, as I was in Tamarack and we were knocking on doors, I spoke to this family for like close to
You're
an
still knocking
hour.
on people's doors with this coronavirus in these streets. So you
Girl,
really for the people. You're really for the people.
well, you know, we have to wear masks and everything, and it's
Yes.
hot, but you got to do what you
It's
got to
hot.
do. But, you know, the people need to see your face. You
Yeah.
know, when you're struggling like that and you feel like you're by yourself and you don't know if you got corona or not. You know, this woman told me that she got a call and they were asking her, has she been by anybody who had corona? And she was scared. She's a vet. And she said she's been calling trying to get all of her benefits, and they're telling her she filled it out incorrectly. And she was like, you know, I have a college degree and you're telling me I filled it out incorrectly. I filled it correctly. And they went back and forth about how they're being deprived from getting everything they need. And, you know, that's what breaks my heart. Why are we still living like that? And,
No.
you know, and the man made a comment. He goes, you know, my wife served, I served, and they treat us so poorly in this country. That's embarrassing. That's what needs to happen.
And I have my mom gets like Social Security benefits, right? Because there's always this talk about cutting Social Security. And if I tell you how much, I don't want to put my mother's business on the streets, but let me tell you, if that Haitian lady did not own a duplex, right, she would not be able to live on that Social Security check. Trust and believe when I tell you this, right? Because she has taxes and insurance that she has to pay every year. And by the time that's paid, this lady would, I don't know what she would be eating. You know what I mean? I literally don't know.
Correct.
So there's a lot of misinformation about like, you know what, and she worked in one company for 30 years before she stopped working. So it's not like the lady didn't work and put in her time, and the money she gets is a complete joke. So when I hear these things about like, oh, we need to like cut Medicare and Social Security because these people are sitting around getting money and they didn't earn it, it's insane. I'm like, I think the people that are saying that have no idea how much money people who gets Social Security benefits get on a monthly basis. How is it that you can advocate more for them and also educate the public about like what's really going on with this system?
Well, you know, it's what we're doing now. We're actually really talking about it, right? And that's where the education is going to come from. You know, a lot of people, when we talk about funding older people, veterans, healthcare, childcare, universal pre-K, they're like, oh, where's the money going to come from? Simply, it's simple, right? The same person who's been charging us 300% in interest, you know, they should pay their fair amount of taxes.
$20 million to give to Ruth Chris with this PIP program that they just had, or PPP, whatever the program was. I mean, a whole bunch of companies got a whole ton of money. And let me tell you what I found incredible about this whole thing, right? So like when we're working and they're telling us that we need to save 6 months worth of salary just in case we have an emergency, we're supposed to, now regular working people without a business, they're telling them to save 6 months worth of salary, right? These folks didn't seem to be able to save 1 or 2 months worth of salary because all of a sudden, you know, we have to shut down for like 8 weeks, and they're like, yo, government, we need a bailout or else we're gonna have to fire all these people. The airlines getting money, everybody's getting money, and like they're telling regular folks with jobs to save 6 months worth of salary, but we have big corporations that are not being held to the same standard. What can we do about that? Because most of them, you know, the big companies got money instead of a lot of the small companies. And I know a few people, like I didn't apply for any of it because I was just like, I don't want these people to come, you know, you apply for it thinking you're eligible. And next thing you know, they said you check one box wrong. And then all of a sudden you're being investigated. And I actually saw that they said that they were investigating some small businesses who they think made misrepresentations to get the funding, right? And I'm like, whatever $6,000 you gave this person does not compare to the 60 million you gave to someone else, and those people aren't going to be bothered, but they're going to bother like low-level people. What can we do about that?
Well, you know, Sandra, I'm sure you're aware of the legislative process, right? The legislative process, there's a lot of people, a lot of eyes reading over it. Everybody's included in the conversation, right? Mm-hmm. So when they first were drafting the CARES Act and the CARES Act was being put on the floor for a vote, one of the things I looked at, I was like, where is the information or where is the language that is going to limit the discretion of banks to favor who they're going to approve for the PPP, right? I didn't see any discretionary language, nor did I see any guidance on how they're going to disperse this. And I got worried. I got worried because I was like, didn't we just see this before when the banks got money during the housing crisis? We just experienced this. And now after all those people, so you have people in Congress, you have their staff, you have so you guys all read this and you guys didn't realize that there was language lacking to ensure that the American people got the money? Come on now. We already know what that is. Vote them out. That's what
dollars.
Right? And so, I think it's a great time that we're living in. 1,200. I think
somebody got 1,200.
I think it's a great time that we're living in because, if we didn't have social media, if we didn't have everybody who was focused on the news, watching what was going on, there wouldn't have been a public outcry. We have to ask ourselves, if there was no public outcry, would they have gone back to correct it? Or was it going to be just like the banking in 2008?
And I don't know if it's even corrected because some people are still like, I haven't gotten anything. Whatever that correction was, I think they did something that was supposed to be more small business friendly or whatever. But if they're like me, like all them receipts, I'd be like, yo, I gotta go look in 10 different places to put all that stuff together to even do this application. You know what I mean? And then I haven't been in my office in God knows how long, because I have young children at home. I got a 76-year-old. How old is this lady? 76-year-old mother.
Your mom? How old is this lady? Your mom?
I have an old mom, so you got to be careful with your interaction, who you're talking to, what it is that you're doing. So it's a really tough time. So even some of the small businesses weren't able to do it, for one reason or another, because things were actually slowing down before the actual shutdown for a lot of folks, I hear
the discrepancy. We have to be cautious. Come on now. Let's look at it, right? In 2008, when we had the housing crisis, most of the people who were in Congress are there now, were there then. They were there then. Right? The same people doing the same thing, having the same conversation. Why didn't you protect us? Why wasn't your first inclination to protect us, the people who are voting for you? We are sitting here in unemployment. The numbers are large. We can't pay our rent. We can't even eat. We don't have health insurance. And there's something out there that's killing us, especially colored people, that is killing us. Why didn't you protect us first is the question we have to ask. And we can't settle anymore. We just can't settle and sit by and allow this to happen. Because if we do, what that says during this election, what's going to say to everybody is that it's okay for us to be overlooked. It's okay for health disparities to continue to perpetuate themselves. And it's okay for economic development to skip us. And we cannot allow that. And that's really what I'm fighting for. And that's really when I'm out there and I'm talking to people, that's what we all are looking for right now. At this point, we won't be looked over. We won't be left behind. We're not going to be skipped. And we're not going to let all the pay and inequality just continue to happen. Because the truth is, a lot of the businesses in our district are owned by either small businesses that are mom and pop, women owned, minority owned, and we're totally left out. We were totally left out. And the truth is, when it came to even getting government contracts, we were being left out of that too. So we weren't able to get government contracts. If we did get contracts, we were slighted. We didn't get as much money as other people did. And now with the COVID crisis, you guys have the nerve to not put language in to protect us?
Yeah, it's interesting. And when you were talking about contracts, and I've been interviewing different people, and I interviewed one of the sheriff candidates, and they were telling me about how there's one person that has the contracts to service the 1,600 cars of BSO. Monthly. I was like, wait, what? You only have one person doing that? Those contracts should represent the whole, everyone. It should have Black people, Spanish people, women, transgender.
Correct.
I'm like, how is it that you have one company that's servicing 1,600 cars every month for BSO? That's insane. Those contracts should be representative of the people that are part of this community, right? And I was like, well, if you're sheriff, is that something that you're gonna do? I'm sure the person with them 1,600 contracts don't want to hear that, but there's no way that money should go to one company and you got all this diverse population. I don't care if it was a Black person that had that contract. I don't think that should be the case. They need to spread the wealth and and give to all the people that are putting them in office and make sure that their contract are a representative of the community that they're here to serve.
Correct. It must be proportionate to the community. It
Yeah.
must be proportionate. We have to have it proportionate, and it hasn't been. So when I ran in 2018, that was my number one thing that I had an issue with. I'm like, let's not sit here and pretend that we don't have a problem when it comes to economic in Broward and Palm Beach County. Let's not pretend, because most of the wealth is concentrated in other areas, and it doesn't represent the people who make up the actual county. And if you look at the reason why, the contracts they were getting, now we're hearing more people talking about, county contracts or even city contracts. And I'm like, that is great that now they're trying to look into it, even though no one has done a real investigation about it. But let's talk about where the real money comes from, the federal contracts. And then when you have a community that, more than 40% call themselves entrepreneurs, and you're not trying to be fair with federal money. We have billions of dollars that come into Florida from federal money contracts. Why aren't they coming to us? And we have to do something about it. District 20, the district that I want to represent, we have 60% women, female women. And with all the business owners that are female, why have we never made sure that we're getting the proper proportion of contracts? Why are we being ignored completely? Why is that?
No, something definitely has to give. Something absolutely has to give. And I think, with especially like the younger kids, and you might fall into that younger kid group. I mean, they're real serious about
that. Thank you for putting me in that group.
There's a couple young guys that I saw yesterday on a panel that's running. I'm gonna shout out Elijah Manley, because that brother right there, like, he came correct yesterday when I saw him. Like, these young guys they're serious, right? They're coming, They got their information, they got their social media, whatever. They got people like that's pushing them forward, and they're really holding people's feet to the fire. They're like, you went up there and you did what? And all the time you were there, why should we trust you to continue to go? And it's definitely something to look at. And it is a new day. And even if, the young, a lot of the young ones don't win, at least they're at least putting a spotlight on the people that were there and making them say, okay, now people are really going to hold me accountable. So if I wasn't doing anything before, if I get myself back here again, I definitely need to do something and represent the people of the county.
Well, I thank you for including me in that young group. I'm 41, and I have two teenagers who are 17 and 16. But I'll take it. If you want to call me young girl, I'm young, right?
Hey, listen.
But
I'm older. but
we have a responsibility, right? It's not good enough for us to say they might not win. No, we gotta make sure they win, because if we don't, what it's the cost.
I have to say that because I don't want to act like I'm endorsing anybody, because I cannot endorse anyone right now. So I have to keep like, if you win, like that. So that's just, let me just clarify that point.
For everybody who's watching, let's make it very clear that we all have a responsibility. When young people get up and have the strength to challenge people who've been there forever, or even you have people like me who get up to challenge those people who've been in there forever, you have everything coming against you, because those people do not want it to change. This system that's in place, it works for them.
It doesn't work for them. It's not working.
It doesn't work for us. And so that's why we have a responsibility. If someone's speaking up for you, we have the responsibility to make sure it happens, because once that person gets elected, now they're going to fight for you. They will fight for you. So we have a responsibility to ensure that they win. So whatever it takes for them to win. If we have to call our auntie, if we have to cook Sunday dinner and invite everybody to come over and, tell them if you didn't vote, you're not eating.
Make sure you social distance.
Oh, yes, social distancing. But if we, whatever it takes for us to do to make sure that we get our candidates elected, we have to do that. Another thing that a lot of people don't understand also is that it's the primary that's the most important election before you even get to November. Right. And if you ever notice, you don't hear a lot of advertisement about voting in the primary, and that's intentional, because in the primary, that's where you actually get to choose your candidate, the candidate who's there fighting for you. And if you don't vote in the primary, once you get to November, you're just going to be voting for whoever they gave you. And that person who they gave you, more than likely, wants to keep the system going as it was. Exactly. And that system wasn't working for you. So we really have to drive home the message that if you want change, if you want to make sure that right now we're deciding how we come out of COVID-19. Let's be clear, right? We can continue with devastation and having our family members losing their life and having, these long-term diseases that are going to come to follow, or we can stop it now. We can continue and not know if we're going to be able to live in our houses, if they're going to not pass another extension, or we can start changing things now to ensure that we get to be in our homes as we get past this. It's today. We make these decisions right here and right now. History is going to look back and figure out what did we do at that time. And so it's up to us and our families to come out and make sure that we change the trajectory. Because the way we're going right now, it's not working.
It's ripe. This is the time. It is definitely, the time is definitely right. It's ripe. All of that to make some significant changes in what's going on. And again, one of the reasons why I really like doing these particular interviews and sessions, right, is because people don't they only focus on a presidential candidate, right? And I'm like, it's very important who the down ballot candidates. We gotta vote for these people that are making decisions about your everyday life. The local elections. You know, people are like, oh, it doesn't matter. Yes, it does. It matters who you sent to Congress to represent you, because that's the person that's gonna fight to get money to bring into your community. You know, so it's important. So yes, the president we have here, like, I'm at a loss for words. You know what I mean? I'm just at a loss for words to see how he's managing everything. Like, he's managing everything in a way that I think is not important. So I'm going to say that we definitely need to vote him out if we need to, and we need to flip the Senate. But we definitely need to pay attention to because Florida don't have a senator in the race this year. So we really have just the rep seats. So we really need to, it's very important who you decide to send to DC and to Tallahassee to represent you, because they're the ones that's going to make decisions that's going to impact your life on a day-to-day basis. So explain to them again how important that is.
Well, I mean, like I said, it's the most important election. August, the primary is the most important election.
2020.
August 18th. But we also know that absentee ballots are going to be coming to everyone's homes on, I think, July 9th. They're going to start getting mailed. So the voting process will be starting July.
I think you have to send in the request for it, but you have to return the request before July the 20th if you want to get one. Right,
but they start mailing some out July 9th. So as early as next week, some people are going to be getting their vote by mail ballots at home, right? And then you have people who will do early voting if they do come in to vote. And early voting starts August 8th. So we have a sequence of voting that's going to go on. But what we have to make sure that we're stressing to everyone is to make sure you vote in there and you research every single candidate. And if we talk about what's one of the most important race that's going to be held in August, it's this race. It's the United States House of Representatives seat. That is the most important race that we're facing. It's the race that's on the top of the ballot. That's how important it is. The first race that you'll see, the first name you'll see on your ballot is Sheila Cherfilus McCormick, because the United States House of Representatives seat for this election is the most important. This is when the district decides if we continue on the same trajectory as we have been for 27 years, where we have 1 in 7 people, seniors who are living in poverty, where we have Americans who still do not have health care, where we see that we've been skipped over when it came to economic development and job skills training. Are we going to continue there?
Right. And the president is still litigating that what they call Obamacare, right? Because he has a bunch of cases in court, and I think one of them is making it to the Supreme Court about whether or not, like, even if they can't just get rid of the ACA, if they can just gut it and basically make it look like nothing. And I have to tell you that I was one of those people that really benefited for, not thinking about not having to worry about having a pre-existing condition in order for me to get like healthcare on my own. As a small business, I can always get it through my office, but it's really expensive. And believe it or not, my pre-existing condition was that I had premature twins. So I had what they call preterm labor when I was pregnant, and then my children were born premature. So when I tried to go get health insurance, they was like, wait, what? I was like, that's a pre-existing condition that will prevent me from getting health insurance? And it's crazy. You would think like that shouldn't even matter. And on top of that, it excluded maternity anyway. I was like, so you're not even going to cover me for having any kids, but the reason why I can't get insurance is because I had difficulty when I had kids. So it's crazy. So I'm just saying that I'm one of the examples that benefited from the Affordable Care Act. And I know a lot of people may not want to admit it, and I think a lot of Republicans act like they don't want it, but they also benefited from it because it was something just that was for people, not necessarily, just you're a Democrat. It wasn't for Democrats. It was for the people living in the United States that needed health care.
Well, at that time when the Affordable Health Care Act came out, it was like ground shattering in the healthcare community, because it's really stressed bringing healthcare up, technologically, right? And that's really what started the electronic process of healthcare and even documents. It's important for where we are now. And it was just the introduction of how do we change pay for performance. Like, how do we do that? So if your hospital performs well, if you're a doctor, you perform well, you deserve to get paid more. But if you're poorly performing and people are suffering, you get paid less. So those things were huge for the healthcare community. What does that translate to now? Him stripping things away from it. We've already evolved technologically. We've already become paid for performance, right? So he can stop coverage, but he can't stop the evolution of healthcare, which positions us perfectly for where we are today, because now we know we can offer telemedicine and cover everyone. We know that we can have a universal healthcare system that covers everybody. And we know that if we wanted to open up a telehealth portal just for the places that are hotspots for COVID-19, do you know we can open that today? Yes. And so we can have people today who have been historically disadvantaged from healthcare call and say, I'm feeling this way, go through a triage through telemedicine, and even get a prescription to go do blood work to find out if they have the comorbidities, such as diabetes, high blood pressure, and high cholesterol that cause, heart conditions. So we can do that today. And, it would be very cheap for us to do that today. So why aren't we doing that?
I tell you that my daughter had when COVID started, I tried, it was time for their annual physical, but of course we couldn't do that. But she had a rash, and then there's we can't schedule it because she has a rash on her hand. There's we could do a telemed thing. I was like, wait, what? And they scheduled an appointment. They're like, we're gonna call you at 7 o'clock. They was like, take some pictures, show us what it looked like. We sent the pictures, and the doctor said, oh, this is what this is. She sent in the prescription, and it was dealt with without us even having to leave the house, right? So I totally get it, and I'm living proof, and I've had that experience where we didn't even have to leave the house. We had to leave. No, actually, they delivered the medicine for us on top of that. So we literally didn't leave the house for the whole thing, right? Because we did it on the televideo. They sent the prescription, and the pharmacy delivered it to the house, contactless delivery and everything like that. And her rash is gone. So yeah, that's definitely cheaper than the way they were doing medicine before. So I do think that they can definitely do better. And
correct. And so we have to ask ourselves, why aren't they? It's a lack of want to. It's a lack of want to, because the people we have right now, they have the greatest insurance. They're sitting there having the great stuff. And it's us who's sitting there feeling sick and suffering every single day. So why are we putting up with this, guys? At this point, we just relate. They can't relate. And so enough is enough, and as like I said, we can't continue on this pathway, especially in the position that we're in right now. This is where we have to say enough is enough and start changing our community. But we're in such a great place right now because we see everybody starting to reject and speak up for themselves. During the COVID crisis, we couldn't sit back on the sidelines and just let COVID take over and wait for the governor or Congress to do something. So we started a program called From My Family to Your Family, where we actually started purchasing hot meals in bulk from local small businesses to stimulate their business. So we would purchase, let's say, $3,000 worth of small plates. And then we would partner with different churches, and we would deliver them through a drive-through to make sure that the community was getting a hot meal and they could sit with their family and eat, and that so the spirits can stay high. These are things that, we should have more integration, so we can have people doing it together and not just, one business owner coming here and there and doing it. We can have more programs on a federal basis, on a federal structure that can help everybody. We also had to step in and start helping people get the PPP loan. In the beginning of it, I remember getting calls where banks were actually preferring. They would call their best clients, who aren't us, and say, hey, this is about to come down the pipeline. Start getting your paperwork ready so we can get you the loan. I'm like, this is crazy. So we actually had to step in and try to connect people to get their finances, their books together, because no one was expecting that. And that's really what it is. When you're a small business, you could be a person who has a great idea and it takes off. No one ever taught you really how to put all your books together to try and apply for a loan that's looking on your history.
A lot of them didn't have and if you had if you use ADP or one of the payroll services, it was easy for you to do your PPP thing because all the forms you needed were kind of right there. Some of us, you just be like, all right, how much you made this week, and then write the person a check and try to take out the taxes or something like that. So that was another thing too. A lot of small businesses couldn't afford to pay a payroll company to deal with their payroll. So when it was time for them to get their paperwork together, it wasn't as easy. Right.
And so, but you see something like that could be, right. So these are things that could have been cured very quickly. One of the things that we want to do once we get into Congress is make sure that we start having these programs where you have people who are giving, free services, or we can actually subsidize where we're having free services where we can help people do their taxes. quarterly, get their finances in order. Because if we can help those small businesses get in order now as we come through this, then the devastation is going to be so much less. And, the government can definitely do it because we see HUD does it. We see the YMCA has people come in and they're giving free tax preparation. And, when you have a business, you're doing your taxes quarterly. So we can definitely make sure we can help people get in line. So there are steps that we can take, affirmative steps to help our country and our district grow. And that's what we have to be focused on, being really focused on and having the specialty and the want to pull us out of this.
So that want to is a big thing. You got to want to. All right.
Yep.
So I'm going to ask you about like some of the general stuff that people want to know. Okay, assault weapon ban. Like, what are you going to do or something like that? If people, we have a constitutional right to bear arms in the United States. Are you going to deal with any of the gun legislation or support any bills of someone trying to put ban on assault weapons and that type of thing?
Yes, I do believe in a ban on assault weapons.
Okay. The other thing. There was another question that I wanted to ask about. So in the meanwhile, while I find my other question, tell the people how to get in touch with you if they want to when they want to support you.
Well, you can always reach me on my website, which is Sheila, SHEILA, for Congress.com, or you can reach me on my text line, which is 855-750-7100, and you can text Sheila Cares if you need any kind of help. And you can reach me even on the phone at 954-668-5358.
All right, and then they can donate. They can
yes, you can donate you can definitely donate on my website. We definitely need the help financially to get out and talk to the voters. The district is a large district. As I mentioned, it goes from Broward County all the way into Palm Beach County. We have mostly all of the minority areas. So it's very hard for us to reach out and get to the constituents and to the voters. So we definitely need the votes. We definitely need the donations to help us reach all the voters and to make sure that we have this change that we're all looking for.
Okay, so we did talk about, so it was an immigration question. We talked about, the path to citizenship. What about the people that are at the border waiting to apply for asylum? Every time we turn around, the president is doing something. He's banning one group, banning people from countries, banning high-skilled workers. He banning people from coming to the United States. How is it that you, where would you position yourself with those issues, and what kind of changes would you recommend with ICE?
Well, I mean, ICE is a huge issue. We have to start by investigating what's really going on in there. I feel like every single day we hear something else that's going on in there with the people who are being locked up, with the children, the abuses. So we actually have to take a really good look at and find out what's going on so we can fix what happened. And as far as the wall and the detaining, it's inhumane. It's totally inhumane, separating families. But the policies that we have put in place with this president, it shocks your conscience. Like it truly is disgusting, and we have to make up for that.
And I think we have to make up for that. I think there's a court order that they were supposed to release the children that were in custody, and I haven't seen any coverage of that happen. Right. Yeah. So yeah, we definitely need someone to go in there, and that's gonna it's one thing to want to be tough on immigration, but it's a whole nother thing to be inhumane when you're dealing with immigrants, because at the end of the day, they're people. Right, you'll call them an immigrant to try to take away their identity or their humanity, but at the end of the day, they're people. The other thing, again, broad topic. DC wants to be a state. Should Washington DC become the 51st state of the United States?
Definitely. So as I mentioned, I actually lived in DC when I went to Howard University. So I definitely believe that DC should be a state. And there is a issue we could talk about that, is a huge issue. We could talk about the issues that we have going on with the protests.
Okay.
Yes, right, the issues that we have. That. It's interesting because, yesterday I was on another live or debate, and it was.
Oh, I saw that.
You saw that? So I was.
It's one of your opponents, I tell you.
I almost fell out my chair.
The chat almost fell out of their chair too.
I said, "Is this candid camera? This can't be real."
I don't think it was real.
But I'm serious. I'm not laughing about it. But
okay.
The nerve for someone to run in a district that is majority minority and Black people and women, to say or insinuate that immigrants bring diseases and that the activists are acting up and to not even talk about the brutality that we have suffered for years, shocked me. And not to even bring up the white supremacists who have terrified and terrorized this country was appalling.
Oh no, the next panel got worse. There was one person that said, "Give me an example of racism." I don't see, I don't see any racism happening or any racist policies that's happening that people of color are being affected by. I was like, okay, yeah.
You see, so I bring this up to say that we are at a critical time right now, and the person we got to send to Congress has to be able to fight like hell. Because there's a lot of people right now who are coming out and feeling like it's okay to hold these biases. It's okay to have police officers brutalizing the people they're supposed to serve and protect. There's a lot of people coming out now. And so we have to be strong when we stand up and defend ourselves. And so one of the questions that people ask me all the time is, what is my position on police officers? Even defunding or abolishing police officers. And I always want to talk about regulations and the need to regulate different industries. And like I said, if your industry has a large number of people who are actually abusing the population, there's a need for oversight and more regulation. So I do believe in reallocating funding. I do believe in reallocating funding where we can actually have a different investigative body that can go in and investigate all of the police departments to find out who are the bad players and restructure it and actually have an independent party who are investigating the police and not letting it be internal. Because we saw that the fraternal order or the fraternity, the brotherhood is stronger than the benefit of the people. And that's what really needs to come to an end. And I think that we have to move swiftly and very sturdy when it comes to regulating certain police departments and making sure that there is no place for bias. There is no place for racism. There is no place for abuse. We have to stand strong on that and start to reallocate funds today.
Yeah, and we need somebody, and the point that I will make on that is that we need to have somebody that's ready day one, right? Because one of the things that frustrated me in some of the panels that I've seen is that people, there's some folks that are like, oh, we'll have a conversation, right? Like, we shouldn't be having conversations now. Like, no, if your answer to any question that's dealing with Black Lives Matter, race, police brutality, reforming, and you starting off like, we need to have a conversation. We are past conversations. And if that's where you're at, then you're not the person that needs to be representing anybody, and particularly an area that have people of color, because conversations don't mean nothing. And if that's all you're going to promise, you can have a conversation, but what action is going to come out of that conversation? So we definitely don't need people I don't think we need someone that's coming in and they're not ready day one. They want to still talk about stuff. Like, we're past talking. Like, there's no way, particularly with this thing that we saw with George Floyd. Like, I don't see how anybody could have watched that and have some second thoughts about that man shouldn't have died that way. There's no way that man should have died that day like that, right? And for you to be like, say, well, trying to find any excuse or any justification on the part of that law enforcement officer is just mind-boggling. And if you're not starting, if your point after you saw that is to have a conversation, then yes, I don't think that particular person would be ready if they're going to make any excuse for those types of behavior.
You're absolutely correct. You're absolutely correct. And I think for too long we settled for people who didn't have a plan. They didn't have a plan, a policy, and they didn't understand the power of the pen. The reason why we elect people into Congress is to use that power of the pen, write the legislation, put it down, pass that legislation. We're not putting people into Congress to say, I've been here, I've seen this, I watched it. This is not a history lesson. This is about action. And this is a time for us to take action.
Yes, it's definitely a time for action. So thank you very much for spending your time talking to me. I think we've been on the phone for about an hour. I'm on the phone. We've been on this Zoom call for about an hour, and that's usually about as long as I want to take. Is there anything else you want to leave the people with before we sign off?
Well, I just want to thank you again for allowing me to speak to everyone who came, and to stress the urgency of the time we are in. This is a defining moment where we get to decide if the Broward and Palm Beach is going to be left behind, and we're going to continue on this path. And I know the people are tired of it. I've been on the front lines every single day, helping with financial support, economic support, food support, and even making sure that whatever people need, they are getting their hands on. And I have a plan for this district. Policies ready. From day one, I'm ready to stand up and to fight for this district and to make sure that we're actually taking affirmative steps. We're actually taking action steps. There's no more time for talking and deliberating or going and having history lessons. It's time for the work to get done. And we need a strong Democrat to send back to Congress to make it happen for our people.
Thank you. So that's Sheila Cherfilus.
Like the song, Oh, Sheila.
Yeah,
yes.
I know it.
Sheila Cherfilus McCormick, like the spice.
That's a mouthful, right? So Sheila Cherfilus McCormick for District 20, or is that how y'all call it? District 20 for the United States House of Representatives seat. She wants to go to Congress. Yes.
We're going to Congress.
Going to Congress. She said it. Listen, she said she's going. And the primaries is August 18th, 2020. August 18th.
Yes. August 18th, 2020. If you requested a vote by mail ballot, it'll be coming around July 9th. You still can request one all the way up to July 20th. You still can register to vote up to July 20th, and you can vote early August 8th. So we're about to start rocking and rolling with this election, and I encourage everyone to come out. This is it. This is our turning point. This is our moment for us to take a stand and say, we are ready. We're ready.
And we're telling people to get the vote by mail ballot anyway, because even if you decide that you don't want to vote by mail, you have the option of going in during the early voting and turn it in. But just in case COVID, we had 6,500 cases in Florida yesterday. So just in case it gets worse and on that day, and if you're immunocompromised or you got some stuff going on and you don't want to take a chance, we want to make sure you vote, because this is so important.
Yes.
You have the last word, and then we're going to go.
Yes, vote. Everybody get out there and vote. We're ready. We're ready for change. We're ready to do this.
Day one, not one day.
Day one, action. Day one. We are ready.
All right, Sheila Cherfilus McCormick, District 20, U.S. House of Representatives. Send her to Congress. Right, have a good one.
Take care. Thank you for having me. Bye.
Thank you for coming.